To me, physical activity means like getting up and getting involved in, even if it's not sport or anything, but just getting active, getting your heart rate pumping, and like becoming a healthier person.
Keeping healthy and like don't be lazy. That's it.
I think I enjoy Keep Fit, and this is my first time to yoga, and I really think it's amazing. I really feel great. It's very hard to explain. I feel sort of as if I'm on a high.
I think it keeps you out of the doctor's surgeries and hospitals because you just don't sit and moan, or you don't sit and feel ill and feel sorry for yourself because you're doing something.
People need to be physically active throughout the whole of their lives, no matter what their circumstances, age or ability. This can be done in a variety of places, in a variety of ways. The benefits of physical activity are many. Improves sleep, improves memory, looks after stress, can be beneficial in a majority of illnesses. Diabetics, people with coronary heart disease. There are so many different advantages of being physically active.
Your blood circulates different, you sleep better, you eat better, and you also find yourself drinking more water.
Well, the main benefits are that I'm a lot fitter, and I've saved a lot of money, and I feel a lot healthier.
Recommendation is that you do a moderate level physical activity for 5 times a week for 30 minutes. Now, moderate activity can be brisk walking. You need to get your heart going a little bit more, you need to get a bit warmer, and you need to be breathing a little bit faster, but certainly not get hot and sweaty, which means it's much more accessible and much more available to most people.
What this means in real terms is that people try to achieve 10,000 steps a day, and this can be measured using a step counter.
10,000 steps is about 5 miles. Not many people are going to go for a 5-mile walk in the day, but you can build up those number of steps through a continual level of activity.
Now let's look at some places where people can actually be physically active. Did you know that some football clubs invest in community health and sports development? Sports development within primary and secondary schools, coach education which is offered for young residents, and social inclusion.
Social inclusion is basically us going out and providing local young people the chance to play sport that is accessible to them, largely on site on housing estates, also in youth clubs and leisure centres.
Well, first of all, Tom, the guy here, he was starting up a basketball club around Newcastle Gate where we live, and I used to go along. I was part of the club, and he asked me if I want to get involved with the coaching aspect of it, so I thought, why not?
The challenge at work is to fit physical activity into a normal day.
I have a very busy job, but I mean, fortunately, this actually speeds up the whole process, and I find I can do more in my job because of the bike. Some people who have to go by car or by tube or train, they have to wait for hours for a bus or whatever, but I can just nip on the bike. I know almost exactly to the minute how long it's going to take me to go from A to B, so it makes my job a lot easier. I mean, I, for instance, cycle for half an hour in from home to the job. I usually do about half an hour cycling during the day, half an hour back again.
Parks and gardens are a wonderful excuse to be physically active outside.
But gardening as an activity can be very beneficial to people who primarily have long-term mental health issues, but also have a number of other long-term physical problems, such as neurological diseases. And what we're doing in the practice is we're developing a therapeutic garden.
Sydenham Garden has been inviting patients in for the last couple of years now, and patients are referred mainly from GPs and local surgeries. They get involved with physical activities such as digging, planting. We've also had them constructing our new community garden.
Healthy living centres were initially set up by the big lottery funding several years ago. Throughout the UK there are many healthy living centres in which all have an objective to reach out to their local communities offering health services. This can range from physical activity to counselling support.
Well, here I can say that the effects of the Healthy Living Centre is multitude. We can see that people that have suffered from strokes, that arrive with sticks, crouched down, with very little motion and or proprioceptive skills, then leave here much more able, sometimes forgetting their sticks. They make friends, and this reaches out throughout the whole community. So it doesn't matter which trail or which route you entered into our programme here. Many people benefit from the social element as well as the physical element, making their everyday living much more enjoyable for them and their families.
Now we'll look at some specific organisations that look at physical activity for older adults.
LOOP stands for Lifestyle Opportunities for Older People. Our sessions are mainly held within community centres, and we do have one or two in the leisure centre itself, but the community centres are nearer the people's homes.
My job is to come to Darwin Court and set up a fitness programme for 50 plus. And I've got a lot of fitness programs here at Darwin Court, sitting down exercises, water aerobics, yoga classes.
Certain conditions can be improved by the introduction of physical activity. People are often very surprised at the amount they can do to improve their condition.
And we're, as you know, seeing huge numbers and huge increases in the incidence of obesity in the community. And a lot of that is from lack of physical activity in the first place. So if we can get that group of people physically active again, hopefully we can do something to address the needs of their obesity problems.
Childhood obesity is a worldwide epidemic. MEN tries to integrate dietitians with psychologists and physiotherapists, so we're all working together, and it's a whole holistic approach really. We've seen improvement in cardiovascular health and fitness, so the children's blood pressures came down, their hearts were stronger, they could do more exercise, more activity, so the children were more confident, happier about their bodies and themselves.
For people with diabetes, building physical activity into their lives is integral. It is something that we should be doing every day, and it's something we should not just be doing on a one-off. It's like we wouldn't take our medication one-off, we would actually take our medication every single day and at regular intervals. Physical activity gives us many, many benefits, and one of those benefits is glucoregulation, and that is the control of blood glucose levels. For a person with diabetes, controlling blood sugar levels is paramount for longer life and good quality of life.
Part of our diabetic management is actually to encompass the entire holistic approach to patient care. So we really do actually emphasise the importance of exercise. I mean, as far as my colleagues and myself are concerned, it's the cheapest form of medicine. So for us, it's important to really encourage and motivate our clients to actually find some form of physical activity that's going to suit their lifestyle and needs.
For many people with diabetes, as is the normal population, weight management is also a key issue. There are a lot of exercise referral schemes or recommendation programs out there that GPs can refer people with diabetes to.
Cardiac rehabilitation is designed for people who've had either a heart attack, bypass surgery or some other procedure like angioplasty or stents fitted. It's also for people who have valve replacements or have been diagnosed with heart failure or stable angina. There are 4 phases to a person's treatment. Phase 1 is when they first go into hospital, either because as a result of a heart attack or because they're having surgery. They're then discharged from hospital and phase 2 starts. They're then invited into hospital as an outpatient, and that's when phase 3 starts.
Yeah, phase 3 rehab was very important to me. I did that at my local hospital, and I did a course of about 6 weeks of exercise and education. And during that time, they taught me about my medication, they taught me about relaxation, but fundamentally they gave me the confidence to exercise in a safe environment.
Phase 4 is when they're discharged from the phase 3, and phase 4 is about long-term exercise in the community.
I learnt that the heart was a muscle. Previously I thought it was an organ like a liver or a kidney, but I've learnt since that it is a muscle, and as a muscle it needs to be exercised and it needs to be developed.
Most people have watched the London Marathon, and you watch the runners finish, the way they arms drop down, they become loose, they bend over. This is the way I am all the time. All you are concerned with is getting some air into you. If you was being strangled, you just want to get those hands away from your throat, get the air going down. That's what we feel. Just let me get air, please, air.
For patients who've got chronic lung disease, is that they have to cope with them every day. There are no holidays. Every day it's the same, struggling with this chronic disease.
As time went on, although I didn't realise, I was looking for ways of less and less exercise.
The problem there is that the less they do, the more deconditioned they become. And actually then, when they try to do things, they're even more breathless.
I was so scared. I thought if I put any pressure on my body, I start getting breathless.
There is a way out of this vicious cycle. We've been working very hard over the last 5 years at King's trying to help these patients. And what we found out is that the key to improving their lot is exercise. It's really interesting because what we found is that simple exercise can actually be more effective than drug therapy, which is the normal approach to trying to help.
And gently you're going to bend one up, nice and slow.
I thought I'd be given a drug treatment and a talk, and that would be it. So I was somewhat surprised to find that the prescription was for exercise.
Laura, why is it so important to be active?
It's important for a number of reasons. It's important to get your muscles as strong as possible. It's important to exercise your joints if they're getting stiff. It's also really important for getting confidence back if you've fallen over.
Yeah.
That as you get older, particularly older ladies, your bones get much weaker. And therefore, if you fall over, you've obviously got more risk that you're going to break something. So getting on your feet, exercising, all those things help make your bones as strong as you possibly can.
Physical health and mental health and well-being are completely linked. In the simplest of terms, your mental well-being or your mental health is essentially how you think and how you feel. And there's lots of evidence around these links. So, for example, people with depression are 4 times more likely to have heart disease. If you experience sustained stress or trauma, it affects your immune system, so you're more likely to get viral infections. So physical activity, as well as kind of releasing all those endorphins and all the other kind of things that are released in terms of your mental health, but also there's a whole social aspect to it as well that's very important for your mental health and well-being.
Depression can range from feeling low to the more severe problems that interfere with your daily life. Studies have shown that regular programs of physical activity can help people to recover from mild to moderate depression, lifting their mood, reducing anxiety, and improving self-esteem and concentration. In some cases, physical activity can be as effective as medication.
People in the state don't tend to join in a lot of activities that goes on because they're not sure how they're going to be treated. To me, doing a healthy walk and doing a fun run brings people in.
It's not easy to change the habits of a lifetime. Change needs to happen step by step. People can make a difference to their own health with a little support.
This is where the work of the health professional, the support work, it doesn't have to be a health professional, it can be somebody who's a member of the family, it could be a friend, but the person who's going to help to support them through this change, this cycle of change. And they'll go through different cycles, but different stages of it. But where they really want the support is through the contemplation, where they're thinking about it. They want more information, they might need information, they want good information. What they don't need is misinformation, and there's a lot of misinformation. If the time of their life is right to accept this change, and they are convinced that they're ready, they have to make the choice themselves, and this is very, very important. You can't make the choice for them. Maintenance is the best part, but all the way through all of these various stages of change, they're going to need support.
And often we tend to praise them, therefore motivating them even more to actually continue to actually manage to do the good work that they've continued to do.
And then hopefully what we end up with is a new habit. And the habit is that they recognise that they feel better, they recognise the benefits of the new physical activity. It becomes an ingrained part of their life.
I think most health professionals now are very aware of lifestyle issues. We've all been down the route of promoting anti-smoking, looking at alcohol, looking now at obesity. I think perhaps we don't advise or ask people enough about their levels of activity. It needs to come up on our agenda, and it needs to come to the forefront of things when we're asking people about lifestyle.
In Lambeth, Southwark and Lewisham, you can find out about the resources mentioned in the DVD by using Primary Pages. Primary Pages is a resource produced by Health First which outlines all the evidence available to support lifestyle changes, but also pinpoints and signposts local services. It is important for people that don't live in Lambeth, Southwark or Lewisham that their local service providers develop a similar resource to that of Primary Pages.
And finally, have you ever made excuses about something you find difficult? Here are some common myths.
As a busy GP, I see perhaps up to 40 patients a day. And you would imagine that in that sort of regime, there's absolutely no time for exercise. But I think everyone can find time for exercise. And this is what I do sometimes in between patients.
It really does. You recognise stress in yourself and you can counteract it with your breathing. I think, as I say, I wish I didn't start until I was about 40, but I wish I'd have started
I didn't start
early.
till I was 80.
It's only 2-mile run. You can either run or you can either walk. The whole idea is for me to teach you how to understand your stamina and then to come out and enjoy the fresh air as well, meeting different people. And you'll be talking to me, oh, what's your name? My name is Philip. Oh, what's your name? My name is Charles. You know, I live there. Oh, I live here. Yeah. You know, we could meet every day and go running. You know, twice a week and go running if you want to.
I do sort of say or mention, gyms and swimming. And there are the few who do want to take that up and actually do find that really beneficial. But for most patients, it's just increasing general everyday physical activity.
We do actually do work in sheltered houses. We have a couple of tutors who go to the sheltered housing, which means that people don't physically have to go out and then do exercise and then come back again. So it's all very much in-house.
I like aerobics. I go to the Elephant and I do aerobics, and I find that I've got arthritis in my hip, but I've got my own limitations, and I find that that's marvellous. I don't think I'd be as well without the Keep Fit.
I think one of the main reasons people join the Health Walk scheme rather than do any other form of physical activity is that it's something that's easily accessible to them. It's walking in our local parks or our local open spaces such as the Thames Path. It's not going to a strange or unusual place. They don't need special equipment. It's free and it's fun, and they're meeting other people.